Good afternoon, everyone. It is my great pleasure to be here this afternoon to celebrate National Hispanic Heritage Month with Dr. Oxiris Barbot. We are delighted that Dr. Barbot has joined us to talk about some key issues related to the health of Latinos. Hispanic Heritage Month runs from September 15th to October 15th. It's a celebration of the many cultural, educational, social, and many other contributions of Hispanics and Latinos in the United States. Among many other Latinos, we celebrate and acknowledge the public health trailblazers, including and not limited to Dr. Helen Rodriguez Trias, whose early work in the 1960s revealed that in Puerto Rico, due to government-sponsored sterilization programs, hundreds of women were subjected to sterilization programs, and these were unwanted, and that Puerto Rico was being used as a laboratory for birth control technology. Dr. Rodriguez Trias was the first Latina director of the American Public Health Association. And like Dr. Rodriguez Trias, Dr. Barbot is another trailblazer. We are delighted that she joins us this afternoon to celebrate Hispanic Heritage Month and to share her thoughts about COVID-19 and other key health issues among the Latinx population, to discuss why public health approaches are so critical, and given the current state of affairs, to discuss how successful health outcomes are vital to powering up a sustained economic recovery. Dr. Barbot is indeed a trailblazer. With more than 25 years of experience, Dr. Oxiris Barbot is one of the nation's foremost leaders at the intersection of public health and healthcare delivery. Her commitment to racial justice is the common thread through her entire career in advocating for children's well-being, community health, and emergency preparedness and response. Dr. Barbot was instrumental in directing New York City's successful response to the first wave of the coronavirus pandemic, and in taking forceful actions that flattened the curve, saved thousands of lives, and made New York City a model for the country to emulate. As Commissioner of Health until August 2020, she made strategic decisions that were consistently grounded in science and moved quickly to tackle overlooked racial inequalities in COVID-19 outcomes. Dr. Barbot made a priority of communicating with New Yorkers with candor and empathy, providing trustworthy information and a steady hand to lead the city through and out of its darkest days. These historic accomplishments are the result of her clarity of vision and courage to follow the science. With a specialty in pediatrics, Dr. Barbot has charted a course for child health that starts with dignity of birth and equity in maternal health opportunities. She has created programs and taken actions that address the underlying drivers of children's poor health and cultivated systems that will ensure sustainable health for children. As New York City Commissioner of Health, she addressed implicit bias in maternal care, and as Baltimore's Commissioner of Health, she implemented a comprehensive approach to improving health outcomes, resulting in record reductions in infant deaths. As the first Commissioner of Health in New York City, she led a delegation of mental health professionals to Puerto Rico after Hurricane Maria to train public health school teachers throughout the island on mental health first aid and in response to the then emerging mental health disaster. Additionally, Dr. Barbot took care of countless poor and uninsured children for many years as a primary care pediatrician. Dr. Barbot's passion for social justice can be traced back from her personal narrative of spending nearly her early years of her life in public housing in the South Bronx, relying on public health insurance and public assistance. As Senior Fellow for Public Health and Social Justice at the JPB Foundation, her work now focuses on addressing the social conditions underlying health inequalities and building back communities post-COVID-19 with an eye towards physical and mental well-being that can nurture every American's full health potential. Dr. Barbot is a Yale graduate. She completed medical school at UMDNJ New Jersey Medical School and pediatric training at GW's Children's National Medical Center. Dr. Barbot sits on many various boards, including the School of Global Public Health Advisory Board here at NYU. Welcome again, Dr. Barbot. Thank you so much for joining us this afternoon. In this webinar, we use the theme, What's at Stake, to talk about the current profile of Latinx health and well-being, and to discuss key potential action items that must be undertaken to address the variety of social and political factors that will determine the future health outcomes for all. And so in that spirit, I wanted to ask you the first question. Clearly, COVID-19, this pandemic is on everyone's minds. It's created so many challenges, public health challenges. It has magnified the deep social determinants of health that put Latinx and other communities of color in New York City at great risk. What are some of the lessons learned from this crisis, even local level, at the global level? What are some of your thoughts with regard to this crisis?
Well, first and foremost, I want to thank you for that gracious introduction, and I'm really excited to be a part of today's celebration of Hispanic Heritage Month. And, you know, I think that in terms of the conversation and framing it from the perspective of what's at stake, the impact that COVID has had on the Latino community, I would start off by saying that the very vitality of our community is at stake. And I think what I'll do in responding to the question is talk about some data from the national and the city perspective to ground us in what the data are telling us in terms of the degree to which Latinos are affected. Then I'll talk a little bit about the risk factors that are especially concerning in our communities, and then how those risk factors have been confounded by the social determinants of health. And I think that will then give us a good pivot point to talk about sort of what the needs are moving forward in the post-COVID rebuild, especially for the Latino community, but for all communities of color that have been disproportionately affected by this pandemic. So, you know, let me start off by saying that at the national level, Latinos comprise 19% of the US population, and that in the over 7 million people who have been diagnosed with COVID-19, 1 in 3 is Latino. And of the over 204,000 people that have died, approximately 1 in 5 or 20% is Latino. And so we need to put an asterisk here because similar to what we found here in New York City, the data is incomplete. And this is one of the ongoing challenges, not only in the COVID response, but in terms of other health conditions where we, as a public health community, as a medical community, are trying to make inroads in that oftentimes critical data is missing indicators of race and ethnicity. So at the national level, roughly 50% of the data is incomplete for race and ethnicity. But in spite of that, we are seeing a significant level of morbidity and mortality amongst Latinos. In New York City, of the over 237,000 people that have been diagnosed with COVID-19, we see that Latinos account for the highest number per 100,000 at 1,955, and account for the highest number of deaths per 100,000 at 265. And Latinos account for 30% of all of the deaths. Now, in this New York City number, I want to just be clear that New York City stands apart from most of the nation in that when we report the number of people that have died, it's not just the people who have had a confirmed COVID test, but those who have been presumed to have died from COVID based on death certificate information. And I think that's a really important point to clarify, because part of the inequities that have played out during COVID is the inequities in access to testing. And I think that not counting people who have died because of COVID, but weren't fortunate enough to get a test, just compounds the inequities. And so part of our emphasis here in New York City was really focusing on ensuring that everybody was counted. And so we are one of the few jurisdictions across the country that are reporting on probable deaths as well as confirmed deaths. And so that then sort of lays the stage, if you will, for the degree to which Latinos are disproportionately affected, especially here in New York City, as having the highest number of hospitalizations and deaths. And so what could potentially be accounting for this? And I, in terms of talking about the exposures, I think first and foremost, we need to talk about occupational exposure. And much of what we have seen is that Latinos are overrepresented in the essential worker population, be they healthcare professionals, be they home health professionals, transit workers, or workers working in food prep and delivery. And this is replicated throughout the country. One of the other occupational risks, which isn't one of the top ones here in New York City, but has been identified as a top occupational risk in other parts of the country, has been those individuals who work in the meatpacking industry. The meatpacking industry, and specifically poultry, having been indicated as an essential occupation at the federal level. So these, as you could well imagine, are not occupations where you can work from home. These are occupations that tend to be dependent on transit, and so present additional areas, avenues of exposure for Latinos. The other thing that I will say in terms of two sort of higher level risk factors that we identified here early on in New York City and that have been found elsewhere in the country is the fact that Latinos, as compared to whites, are more likely to live in multi-generational households. And this presents additional risks for exposures and poor outcomes. For example, if young family members bring back infections that then affect older members who may be at higher risk for hospitalizations and deaths. The other risk factor that is especially seen in communities of color and Latino households is overcrowded housing, and the degree to which overcrowded housing makes isolation and quarantine virtually impossible. And so those three sort of high-level additional risk factors are confounded by the social determinants of health and policy issues that make those risk factors even more deadly. So for example, the fact that in many parts of the country, Latinos in the service industry don't have access to paid sick days, and the fact that they have to go to work or else they won't get paid and they won't be able to pay their rent, feed their families, etc. The degree to which low levels of health insurance affect Latinos' ability to access care also compounds these risk factors. And then, that we can't forget the degree to which anti-immigrant rhetoric compounds these risk factors, and specifically concerns around public charge and accessing supports that can help make isolation and quarantine safer at home. And so all of these, to varying degrees, played out in New York City the way in which they have played out in other parts of the country. I think one of the things that sets us apart from other jurisdictions is the degree to which early on in the pandemic, we took into consideration housing instability, food insecurity as major drivers of families' inability to safely isolate and quarantine at home, and the degree to which we were able to allocate resources to provide free hotel rooms and provide access to free food, again, to make it easy for people to isolate and quarantine either at home or in one of these facilities. The other thing that I would say is also the importance of relying on trusted community-based organizations that have deep roots in communities, and the degree to which they can make sure that people who are afraid of getting tested and what that might mean for their families, for their communities in terms of drawing unwanted, anticipated, or perceived unwanted attention to themselves, bring them in a way that creates trust in the process and provide security in terms of housing and food. And so the degree to which CBOs are a part of the vital infrastructure necessary to support Latinos through this pandemic is really something critical that I can't overemphasize. The other thing that I will touch upon, which is something that I think needs to get more attention, is the degree to which Latinos don't have the type of generational wealth transfer that white families have that can provide a cushion, if you will, during this pandemic. I think in the media and in our daily lives, we've heard of so many people who have been able to come home to their parents and be able to isolate and quarantine at home. Young people who may not have lost jobs and who may have had to give up roommates or give up apartments. They were not left homeless. They were able to come home because of the stability of housing that their families were able to get more often than not through the transfer of generational wealth. And if we look at the national level, before the pandemic even began, there was already a wealth gap of $1.3 trillion between Latinos and whites. And I think that as we move forward, thinking about and planning for how it is that we can set up our communities for health, we need to really think about the economic consequences, both in terms of the sectors that have been affected. There was actually just an article in the Washington Post this afternoon that talks about how this economic catastrophe is different than any other economic insult this country has suffered in our lifetime, in that it is people of color, people without college degrees, people in the service sectors that have been disproportionately affected, especially when you compare to the Great Recession of 2008, 2009, where it was more often than not white collar workers who were able to rebound faster. And so when we think about the risk factors, the compounding factors that are specific to Latinos, and how it is that we will best situate our communities moving forward, it's not just thinking about housing security, food security, access to health insurance, but it's also thinking about the economic engines of our communities and the degree to which our communities tend to be entrepreneurs and how we can support them in bouncing back and building on the resiliency. So that's a bit of a long-winded answer to talk about, you know, how COVID has disproportionately impacted Latinos, what's at stake, and what are the various ways in which we need to think about how we build back our communities so that Latino communities, people of color, are not left behind.
Thank you, Barbot. You've raised so many important issues that perhaps are not all that obvious. Among several of the things that you said, you mentioned the importance of community-based agencies, the wealth gap. So our theme of Hispanic Heritage Month, you know, they're the trailblazers, the people who lead these CBOs and other agencies. Just given all the comments and your insights about the lessons learned from this pandemic, what do you think remains to be done in terms of addressing some of the issues that you have raised? And what's at stake if we don't take the actions that you think we should be taking or should have taken? What are things that remain to be done, and then what's at stake if we don't take these actions?
So specific to the social service sector and CBOs, you know, one of the things that I would tell my team during the height of our response is to not lose sight of the things that we were letting go of and suspending so that we could get money out the door faster, so that we could serve communities faster, and reminding them to really think critically about the fact that if we could stop doing those things during an emergency, what's keeping us from rethinking how it is that we provide these services post an emergency? And so, for example, I think one of the things that is critical for the social service sector, for CBOs that are providing such critical services in our communities, is to provide funding that covers their costs. You know, in this pandemic, if what's at stake is if we don't continue to have a robust CBO infrastructure, social services infrastructure, then, you know, it all starts falling apart, because these are the very organizations that help not only Latinos, immigrants of all shapes and sizes, poor people of all shapes, stay in their homes, provide for their financial stability, but also address mental health issues. And so providing a reimbursement structure for CBOs that takes into account their costs, you know, making the contracting process easier so that there aren't so many hoops to jump through. This is our opportunity as a city, our opportunity as a state and a country to rethink why it is that we do certain things, to rethink what our priorities are, and to let those priorities lead the funding, right? It's reimagining what it means to have a vibrant city, and remembering that as a city, we're only as healthy as our most challenged community, and that unless we have a strong CBO infrastructure, we're going to have many, many more distressed communities.
Thank you. And you also mentioned the wealth gap, the need for trust. What do you think about policies that might help immigrant families do better? Is this also a function of CBOs or other components? You actually mentioned the social service sector, so those also play a role. Yeah.
Certainly. You know, I think in this era of COVID, of Black Lives Matter, of anti-immigrant rhetoric, it's so critically important to leverage more voices, more diverse voices, to ensure that we continue to have trust in one another, right? In these days that feel so dark, I think it's easy to lose trust in institutions that, you know, prior to the COVID pandemic, were institutions that were seen as looking out for the health of Americans. And, you know, to the degree that we can rely on one another as fellow Americans, I think is important until we are able to turn the corner as a country. And this trust is important for a whole host of things, right? So when we as a country start having conversations about our highest elected leaders not trusting institutions that have a charter of looking out for the health of our country, like the CDC, like the FDA, that has a more insidious, long-term degradation of our fabric as a country. And so it's incumbent on all of us to remember that at the very basic levels, we need to rely on one another. It's, you know, it's what we as New Yorkers do and have done in times of crises, which is look out for one another, right? We did it in 9/11, we did it in Sandy, we're doing it in COVID-19. And so this trust is going to be critical as we move forward in the COVID response to make sure that there is trust in the vaccines that are being developed to keep all of us safe. And so, you know, it's part of acknowledging that there are some communities who, because of historic injustices, don't trust government. And as government officials, we have to be cognizant enough that it's not just about government officials conveying messages, that we have to work in collaboration with trusted partners and CBOs, because at the end of the day, we are all, our collective health is dependent on one another. So this issue of trust is critically important for people who are sick to be able to access care without fear of immigration, without fear of public charge, et cetera. For when we get vaccinations, people trust in those vaccines will keep them safe and healthy. And that as we move forward in economic recovery, that there is an emphasis put on ensuring that all of our communities have an equitable opportunity to succeed economically.
Dr. Barbot, touching on some of the issues you've already raised, obviously during Hispanic Heritage Month, we reflect on the great accomplishments such as Latino trailblazers like you, the first New York City Commissioner of Health as a Latina. Despite the great strides of the Latino population, what do you think are some key areas, either in terms of health, education, or other areas, where you think immediate action is needed? And you were trained as a pediatrician. Your role in public health is tremendous. Why do you think the public health approaches are so critical to address some of the areas where you think other immediate action is needed, whether in terms of health, education, or other areas?
I think that's a really important question. And I think that then brings us to other social determinants of health and the impact that they have not only in the immediate COVID response period, but for the long-term post-COVID rebuild. And, you know, one of the areas that I haven't touched on, which it's important, and I thank you for this question because it's an opportunity to talk about this, is the area of education. And here I think it is multiple areas of concern that I think we need to have more innovative thinking, more intentionality around addressing historic inequities. And when we think about taking a public health approach, I think for me, what that generally means is one that is data-driven, one that is informed by an equity lens, and one that takes into account a multi-sectoral approach. And so, for example, in the area of education, one of the things that has become, I think, painfully apparent is the degree to which the digital divide is affecting our children. And, before COVID, we had talked about the digital divide, but I think truthfully that conversation was generally, it started with the digital divide between urban and rural areas. Then it went down to the digital divide between, white and people of color, but in areas not necessarily focusing on primary education. And so the need to have remote learning for children in elementary, middle, and high school, I think has really added a greater dimension and a greater urgency for addressing the digital divide that includes, ensuring that communities of color have access to broadband, ensuring that families of color have access to tablets. And one of the things that I've really thought about and to a certain degree have taken for granted, but I think, again, COVID brings up in a very vivid fashion is the degree to which households of privilege have more than one electronic device, more than one tablet, the degree to which households of privilege have multiple adults that can provide technical assistance that children may need to learn how to navigate a new electronic device, and how we take that for granted. And so, when we talk about the post-COVID rebuild, I think it's critical for us not to forget the digital divide, not to forget the importance of ensuring that school districts in communities of color are well-resourced for technology. The other thing that I will say in terms of education and what this COVID pandemic brings up for us is the importance of leveraging schools to provide mental health resources for our children. I think that one of the things that this pandemic has done for us is really highlighted acutely the mental health impact of this pandemic across the age span. When I was commissioner, I took great pains to talk about the degree to which New Yorkers would be going through the 5 stages of grief through COVID response, right? The denial, the anger, the bargaining. If I wear a mask, if I don't wear a mask, then it will make things better. The depression that came with it, and then ultimately the acceptance, and how people go in and out of those phases, and reminding New Yorkers that, there's a tremendous resource in NYC Well. But I think the reality is that we need to take more intentional approaches for addressing the needs of children. I think all too often, and I saw this when I was in clinical practice as a pediatrician, and when I was providing public health support in Puerto Rico after Hurricane Maria, is that all too often we as adults take for granted children's resiliency. And we say, they look like nothing ever happened, they're playing. When in reality, we have to acknowledge that there's a certain subgroup of children that are internalizers to trauma, and other children who are externalizers to trauma, and that we have to build systems that take both into consideration, and that the effects of the mental health effects of COVID on children are going to be long lasting. And to the degree that we start now ensuring that we've got mental health supports in schools that address both the internalizers and the externalizers is going to be critical for the long-term really health and vitality, not only of the Latino community, but the community at large. And one of the things that I have said in other interviews is that if we don't address the mental health needs of our children, of our young adults, of our current adults, then we will be, I think, in a much darker place in the post-COVID world, because when people act out of fear, out of isolation, out of anxiety, they don't make the best decisions. And I think that this disaster reminds me to a great degree, again, of when I was in Puerto Rico post-Hurricane Maria, where in that, I spoke about how it was one of those disasters where people who were responding were also intimately affected by the disaster. And I spoke to countless number of first responders who were dealing with the stress of responding to the needs of their community, while at the same time having people in their personal lives, friends, family members who had completed suicide, who had contemplated suicide. And so it's that added emotional toll that in this COVID situation, I would say the vast majority of us are in that same situation where we are intimately affected, but we're also responding to the needs of those that we serve. And so to the degree that we have in place mental health supports that provide primary, secondary, and tertiary prevention, I think we'll be that much better off as a city and as a country.
Thank you, Barbot. Dr. Barbot, I know you've always been, during your time at the Department of Health, that mental health was always a major priority of yours, and that you see this as an ongoing issue that crosses sectors, education, et cetera, is so important as we plan what's at stake if we don't take action. You mentioned your work in Puerto Rico during Hurricane Maria, and this leads to another question about the Latino community, the population. As you well know, Hispanic, Latino, Latinx this encompasses many different groups of nationalities, of racial backgrounds, of identities, and not all of us identify as one big, happy Latino community. In what way, if at all, would you say that this heterogeneity or our self-identification has created public health or other challenges? For example, with respect to the census, political action, in what ways would you say that this pan-ethnic or lack of pan-ethnic identity is creating challenges that we need to address? And then what's at stake if we don't address it?
Yeah, I think that's a really critical question, and one that we at the health department, when I was there, started to address actually before I became health commissioner, and when Dr. Bassett was health commissioner. We issued the first ever report on Latino health, teasing out the differences in health outcomes by subgroup, and highlighting the differences in health outcomes for Puerto Ricans, Dominicans, Central Americans, et cetera, because those differences help to inform how it is that we best collaborate with communities and move forward in addressing issues that give us the greatest opportunity for sustained good health outcomes. I think that the other area that I would say, especially with regards to the census, this COVID pandemic has really aggravated a problem that was already significant, meaning in the underreporting, the undersubscribing, if you will, of New York City to the census, and especially in the this administration, the degree to which anti-immigrant rhetoric was frightening people in terms of potentially disclosing their status to government officials and putting their families at risk, whether they were mixed status households or not. And so that is an area where, again, trust is critical, because of the importance of being counted and the degree to which that then impacts funding that comes to the city from all different parts of government. I think the last thing that I will say in terms of the heterogeneity within the Latino population, I think is the fact that it's not just heterogeneous in terms of immigration status, but also generational status, and the degree to which is sort of a part of that, but I don't think gets enough attention, because to the degree that later generations of Latinos have different health outcomes than more recent immigrants, also, I think, provides complexity to the way in which public health programs are designed for Latinos, the way in which policy plays out in different communities. I, as a Puerto Riqueña who grew up in New York City, our sort of journey, if you will, from the island to the mainland, while it has many of the components that other Latinos have in their immigration history, doesn't have the issue of citizenship. And, it's incumbent on us as Puerto Ricans to say, it doesn't matter what my status is, as long as my brothers and sisters from other Latin American countries are suffering because of status, that has to be my fight as well. And that's why it's important when we think about healthcare delivery, when we think about public health programs like nurse home visiting programs, like WIC, like public assistance, all of those services that ensure the health and safety of our community, that we don't lose sight of the fact that, again, as long as there are those among us that are most challenged, we're not going to be as healthy as we could be otherwise.
Thank you, Dr. Barbot. Can you tell us a little bit more about how entities such as Change Lab Solutions can help to address some of the issues that you've already mentioned, and how can these entities and organizations advance the health of Latinos and ensure healthy lives for all populations, not just Latinos?
Yeah, thank you for asking that. Change Lab Solutions is a nonprofit organization. I happen to be on their board, and their mission is to make the law and public policy work for communities, and to ensure that all communities, especially communities of color, have the ability to thrive and flourish. And the way in which their work is critical to Latino communities, to communities of color, is to ensure that policies that can hardwire wellness into the fabric of a community have the best opportunity to pass. So for example, they're very much involved in working with jurisdictions around the country on taxing sugary sweetened beverages, for example. They were very instrumental in passing tobacco control legislation in different parts of the country. And they are one of those organizations that are working across the country to ensure that public health principles and those of healthy housing that's quality housing, are not taken for granted, and that communities, especially Latino communities, have access to healthy housing. One of the things that I will say that is something that I noted in New York City, both during COVID, but also in the pre-COVID world, was the degree to which housing instability affects health outcomes. We did several studies through the health department looking at the role that gentrification played on mental health outcomes, and the degree to which people who are displaced from gentrifying neighborhoods to neighborhoods that are not gentrifying have their mental health aggravated and see an increase in mental health emergency department visits. The other thing is, in terms of, for example, work that we were doing in asthma, what we found was that families and communities living in apartment buildings where there were high levels of immigrants who were afraid to speak out against delinquent landlords and were forced to live in substandard housing that was aggravating their children's asthma. I think those are areas where organizations like Change Lab can work in collaboration with community-based organizations, in collaboration with community activists, to ensure that from a structural level, from a policy and law perspective, we hardwire wellness into our communities. And that's one of the things that I think is most important about a public health approach, right? It's not just about sort of launching an initiative. It's about doing everything possible to ensure the sustainability of that intervention that has been demonstrated to improve outcomes, including, again, the passage of policy and laws that will hardwire it into a city's fabric. And, you know, the other thing that I will add is that I think in New York City, we have a long tradition of passing laws before the federal government in terms of protecting and promoting the health of our residents. I think the most dramatic being eliminating lead from paint 10 years before the federal government did. And so it's organizations like Change Labs that, you know, we're able to inform the strategy on tobacco. You know, when we were as a city first looking to reduce the burden of tobacco use in our city, and then later on in terms of reducing the burden of sugary sweetened beverages. It's that kind of role that organizations like Change Labs play an important part in the overall public health approach to improving health, not only in our city, but across the country.
Sounds terrific. Dr. Barbot, you've spoken about so many key important issues with regard to COVID, census, policies, education. There are many students and public health professionals at the early stages of their careers that are participating in this webinar. What advice would you give them at this stage of their careers?
You know, I think the most important thing that I can advise is for students to really hone their craft, right? To be solid in the very foundations of public health in terms of data analysis, policy analysis, the technical skills, if you will, of doing public health. But that along with that, we need a public health workforce that brings their heart and soul into the work, that brings their equity lens into the work, that will help move the field, move our country to be more just and equitable when it comes to health outcomes. I think one of the things that sets our health department apart is that we, I think, have incredibly talented staff at the New York City Department of Health that combine their technical skills with their advocacy skills to ensure that when we are engaging communities, we're doing it from a perspective of engaging communities in talking about what the data show, not inserting ourselves into communities and saying, this is what you need to do in order to be healthy. I think that that's where public health needs to go deeper in, and the degree to which we have students and young public health professionals infusing that advocacy spirit into our profession, I think will be great for our country.
Thank you, Dr. Barbot. We have a few minutes left, and we have some question and answer, some questions that have been posed by the audience. I'm going to select a few because we have just a few minutes, and if you don't mind maybe taking a few. One attendee asked, what was your main barrier as a former New York City Health Commissioner to improve the health of Latinos?
I think the main barrier is that in order to improve the health of a population at a sustainable level, there needs to be alignment in all of the areas that we refer to as the social determinants of health. And so, to the degree that we were able to influence housing, education, economic development, community planning, to then align to improve the health of a community, that really is the major barrier. We were able to do that in small pieces, but I think that part of the challenge was being derailed by COVID. Though truthfully, I am an eternal optimist, and I think that the degree to which COVID has ripped the scab off of how inequities are playing out in New York City and across the country, I think will give the needed momentum for cross-sector collaboration that will make better health outcomes faster, more of a reality than it was even a year ago.
I think we have time for maybe one more or maybe two more questions. Another member of the audience asked, back to the trust question, how do you increase trust among Latinos in city agencies when there is very low social and economic investment in Latino neighborhoods? Where do you see the role of maybe other agencies in addressing some of these issues? Lack of investment.
Yeah, I think that's a really important question. And I would say that there were two very concrete things that we did at the health department to begin addressing that very question. One is we were very intentional in our MWBE spending, so minority women business enterprises, and ensuring that when we were procuring services, we first looked for MWBEs to provide those services. And that's a very concrete way of supporting community businesses serving our communities. And so we saw significant increases in the percentage of dollars that went to Black and Latino businesses. Beyond that, we looked especially for the gender divide. And, one of the areas that we were falling behind in was Latina-owned businesses, and doing intentional outreach to get more Latinas to be MWBEs providing services to city agencies. The second thing that we did that was very intentional was to have more dollars pass through the agency and directly to CBOs providing services to Latino communities. Because again, it wasn't about us doing all of these programming, it was about supporting community-based organizations and supporting the sustainability of those organizations. And we actually piloted to very successfully having non-health CBOs take on health issues. Because again, a public health approach, you don't necessarily have to be a health social services entity. You could be, an entity that provides, let's say, economic development in your community, but you play a very specific role in the health of your community. And so thinking creatively, innovatively about how we engage non-health serving organizations in the public health agenda was another way in which we increase the level of trust in Latino communities.
Thank you, Barbot. We are at the hour. I want to thank you again for so graciously spending time with us this afternoon. And given all the important issues that you have identified, I really would like to encourage everyone who's listening to please make your voice heard, regardless of whether you're Latina or not, white, Black, Asian, whatever whatever background, please take advantage of your voice and vote. It's so important that your voices be heard. So thank you again, Dr. Barbot. It's been such a pleasure spending time with you this afternoon. And we want to encourage you to keep up the good fight for social equity. You are such a wonderful role model to so many of us. And we again appreciate your time. Thank you.
Thank you. Thank you. I really enjoyed our time together. Thank you.